I'm Dr. Kimberly Manning.
And this is Dr. Ashley McMullen. And you're listening to the Human Doctor Podcast, where we explore the human side of medicine, along with teaching, living, learning, and all things in between. Using the power of storytelling, conversation, and connectedness.
Hey, we're two dope academic internal medicine doctors, but we ain't your doctors. So if you perceive anything we say here as medical advice, no, it ain't that. Also, the things we say, they only reflect our brilliant Black woman magic mind and not our employers.
You could have been anywhere, y'all, but you chose to be here with us, and we appreciate you. Let's go.
We are live in the evening.
Well, evening in some areas of the country.
I know, it is pretty bright there. I'm sorry.
It's very bright.
It's dark here because I am on the hospital service, and I appreciate you accommodating you, girl.
Always. I do what I can.
I had a first-year medical student join me on rounds this weekend. He's actually a student at Emory. Hey, Jaden, who I tested one day in one of our oral exams, and I was giving him feedback afterwards, and I saw him in the hallway and was chatting. He was like, you know what? Can I come to the hospital and round with you one day? I was like, sure. You know what was so dope is, my team was capped. We rounded just the two of us. We had run the list with the team, but the two of us rounded on all the patients. But every single patient we went to that was cognitively able, I asked, this is a young doctor. He's in his first year of medical school, and he's just learning. What advice would you give him to become a great doctor? Man, people said some dope things. Man, they just said some great things. One person said, just listen. Listen to the nurses, listen to your patient, listen to what people are not saying. Another person said, try to love what you do. Figure out something to do that you love, because if you don't love it, we bear the brunt of it.
Ooh, wow.
Yeah, that's it. That's a word. People had some words for me. It was great. It was really choking me up.
That's amazing. Well, I look forward to you cataloging those and sharing them, because I think that there's probably more than just the first year medical students who could benefit from that.
I know. So great. I loved it.
Man.
What's up with you? What's new?
So I got to share this with you.
Okay.
So there is this, I don't know what to call it. It's kind of like an amusement park, but it's just you could tell it was very low tech, built probably in the 70s or something.
Okay.
Out here in Oakland that I pass by all the time. It's called Children's Fairyland. So it's all these giant toys and houses. They're kind of it's kind of based off of these old fairy tales that people probably don't remember unless you're of a certain age. It's very colorful, and I've been living out here for 3 years. I run past it all the time, and I just wanted to know what it looked like inside. But you can't go without a child.
Oh, you can't?
No, they make that very
I love that
clear.
you actually plotted to go without a child.
That's
I
mean,
awesome.
I just saw the sign. I was like, okay, well, this makes sense. So, but thankfully, my colleagues.
No.
No. So I want to shout out to Emma Shack, who
I do know Emma. Hi, Emma. Hi, Josh.
Who has children that I could borrow to get into this place. So Emma was kind enough to bring her 2.5-year-old and her months-old baby out to Oakland so that we could go to Children's Fairyland, and I had a really good time.
Was it everything that you thought it would be?
I don't know what I thought. Part of me thought it looked haunted, but it was just it was very lovely. There were so many children around. It was sunny. It was just really sweet. And because it's just there's no phones, there's no screens, there's just kids running around, and they're all you have to be pretty little to enjoy stuff like that. So, it was
you have
cool.
to be really little, or you got to be Ashley.
Or you have to be me. So I got the best of both worlds, because Emma just happens to have really, really adorable children, and I got to see the inside of the Fairyland. So,
oh my gosh, that is so great. I like that you initiated this entire play date as a grown-ass woman.
I'm not ashamed.
And you should not be. You should not be ashamed. Hey, do what you do.
Thank you.
So I know I keep saying this every week, but I don't know if there's a Children's Fairyland in Boston, but We're yet another shameless plug.
That was such a great segue.
Wasn't it?
Yes.
I actually think I'm pretty witty personally.
Yes.
But I just would like you all to know that at the Society of General Internal Medicine National Meeting, which is going to be in Boston,
Mhm.
which I hope you registered already, and I hope you booked a hotel. We will be there,
Mhm.
and we will be presenting, and we will be recording with a special guest.
Mhm.
And we're just going to be walking around naming hair and giving fist bumps. It's just going to
Mhm.
be awesome. Mhm.
I am hyped. Me and Mahaley have been in conversation around what we're gonna look like when we get there.
Did you hear about Tabitha Brown's book? I did a new thing.
No,
Okay. Tabitha Brown, you know who we love, Tab, right?
love Tab.
Yeah, Tab has a new book called I Did a New Thing. And it's basically talking about her. I haven't read it yet, actually. But as a part of the book launch, she did 31 days in January of every day do a new thing and had people like share on social media. And her hair, named Donna, she did a new thing with Donna for every one of her appearances. And I mean, Donna was doing the most. It was a lot going on. So maybe you'll do a new thing.
Yeah, we'll see.
Yeah.
We'll see.
Yeah. And I know you love Tab, so you got to check that book out. I can't believe you hadn't read it yet
Hey man, I will read anything that Tab puts pen to paper on. So
because
that's
she
next
be
on the
dropping
list.
a word to make you feel good, right?
Yes. Yes.
Yeah. So let's do a new thing.
Before we jump into new things, let's continue the things that we all showed up for on this episode because we love the good words from Grady Doctor, otherwise known as the Dr. Kimberly Manning, clinician educator extraordinaire, nationally renowned professor of medicine at the School of Medicine at Emory University. One of what's the statistic now? Less
Less
than
than 1%.
1%.
Mhm.
Yes,
Yep.
but
Yep.
she is opening all the doors for those of us to come up. So,
Baby, holding it open, holding that thing open. Yes, I am.
what is the what?
The what is difficult.
Difficult. Okay.
Yep. Difficult.
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 Uh-huh.
Difficult as in patience
Yep.
that people
Okay.
call difficult.
That is exactly where my mind went, but I didn't want to
Yeah.
say it out loud. Yes.
Because you are a general internist and you've been told that somebody's difficult.
Hmm.
Mhm. That is
Hmm.
such a loaded word too, right? It can
It
mean all kinds
is.
of stuff. A lot of times when people describe somebody as difficult, it can mean that they find them unpleasant.
Hmm.
Maybe they're not cooperative to them. But a lot of times it's just that somebody said it, and then somebody else said it, and then somebody else said it. And then how you perceive the person is all based upon the things that were fed forward to you, right?
Hmm.
So I'm going to take you back not super long, maybe like about 8 years ago, which for you is a long time ago because shoot, you young in the game, but
Okay.
I was fully on the faculty.
Yes. Yes.
Sorry,
Okay. We got you.
to age myself. But anyway, I was on the hospital service and there was a patient that had been admitted to my service. And this patient had been admitted the evening before, and by the time that I got to the patient, it was the next morning because he'd come in overnight. And what I'd heard already on sign out, and I'd even seen in a few nursing notes, is that the patient was, what was the word that they used? Contentious and stirred up a lot of conflict. They were just finding like, yeah, this dude is difficult. He'll cuss you out. And the reason why the patient was there is because he had actually been at a neighbor's house. They were, relaxed in the backyard playing cards on his off day. And he became diaphoretic and had some chest pain. And, the friend, rightfully so, did not mess around because he looked like near syncopal. They called 911. They picked him up. He felt really bad. So they let him bring him to Grady. And he was having an MI. He
Heart
was
attack.
heart attack. Yep. He
Mhm.
was having a acute coronary syndrome, heart attack, MI, whatever you want to call it this week. He was having that and it was bad. It was a blockage in one of his blood vessels. It was not good. So, because of the emergent nature of all this, cardiology came in. They did a catheterization, which is where they instrument your arteries that feed your heart, shoot dye around them, and look to see if there's any blockages. And indeed, he did have a blockage. They were able to put a stent in, which kind of opens up a blood vessel. But there was still more that they needed to do. His heart had been injured, and so it wasn't pumping at full strength.
Mhm.
And, if you're a doctor and you're annoyed by me using, living room language, get over it. Other people listen to this besides doctors. Anyway, after all of that, he is now back on the floor and he has this big dressing on his leg because they had instrumented him through his artery near his groin. And they were like, we may need to go back and take him to the cath lab again. But I'm being told after the first day I met him that he's trying to leave the hospital. The nurses are calling. Everybody's like, yo, we told you this man was difficult. He up in here going off. He took his IV out. He got his
Mm.
pants on. He about to go. Like, and when I met him, he was getting ready to go to the cath lab and he was kind of scared. So we got on cool. He was cool. His brother, was cool. So I come in there and I'm hearing that he's going off and I'm actually like kind of looking forward to seeing him because I like a mad patient, because a lot of times when people are mad, it's because
Mhm.
nobody's listened to them. They just feel like undermined, people being passive aggressive. And I was
Yep.
like, you know what? I have racial concordance with this man. I have cultural concordance with him. And we got on well when I met him. So, me puff my chest up, dust my shoulders off, bring all my swag into the room
Mhm.
to see him. And it's just the two of us. So I'm like, no, I ain't even doing this in front of anybody. I'm about to, get this dude off the ledge and we're going to take care of his heart. So I come in and I sit down, and dude I still remember he had on a flannel shirt. That thing was buttoned all the way up. He had the telly box off. It was sitting on the bed. He was ready to go. I was like, sir, what is going on? Like, what you doing? He was like, I need you to discharge me. And I was like, yeah, whoa. Look, can we talk about it? He said, no, I need nothing to talk about. I need to go. And I was like, okay, look, where you gotta go? Where you going? I was like, look, man, you ain't but like 48 years old, and you have had something life-threatening happen to you. You could like die. This is really a big deal. And I think we need to kind of like watch you a little longer and figure out what the cardiologist is gonna say. That's cool. I knew you was gonna say that, but yeah, I gotta go. What do I need to do? So he's like doing the thing where you be looking around the room, looking
Mm.
for where your other shoe is.
Mhm.
He putting some lotion on his hands. He is about to go. Come on. So I pull up a chair. I sit down. I'm calm. I'm like, you know, I, I really, really want you to stay. I will be sad if something happens to you. I really want to take care of you. I really want you to let me take care of you. And he looked at me like we were having a moment and he
Mhm.
goes, I gotta go. I was like, hey. So then I was like, all right, I gotta take another angle here. I was like, do you have children? He said, yeah, I have children. How many children do you have? He said, I have 4 children. Okay. I said, do you have any grandchildren? He said, I do. I have 2 grandkids. I was like, wow, you got 2 grandkids. You got 4 kids. You just had a heart attack and you're getting ready to walk out of the hospital before we can complete treatment. And he was like, ma'am, I appreciate what you're trying to say and everything, but I'm very serious right now. I'm trying to go. So they told me it's some paper I need to sign that says I left, even though y'all didn't want me to leave. I'll sign it, but I gotta go. So I keep on, like I just keep. I'm like, what's your kids' names? Nika, Tommy, Junior, and Robbie. So I'm saying their names back. I'm like, man, do you know how devastated they would be? What are your grandkids' names? Gives me the grandkids' names. I said, do you know how devastated they would be if their granddad walked out of this hospital and actually became disabled because he didn't stay to do what we needed to do? Come on, man. Come on, man. I need you to stay. So I'm holding his hand. I'm looking at him. He pulls his hand back and he was like I said, I really appreciate what you're saying, but I'm gonna need you to get that paper for me to go. And I was like, gosh, like, what is going on? So I kind of get a little spicy. I'm like, you know what, man? What could possibly be more important than you seeing about yourself so that you can be okay? But it's family that clearly loves you. You told me you got a wife. You told me you got 4 kids. You told me you got 2 grandkids. You got a world of people that love you. And you basically just don't feel like being here anymore. And you getting ready to go. What they do that at? What are you like? What is this about, man? What did I say that for? That brother pushed that little rolling tray table from in front of him. I mean, it made me jump. Like he pushed it away, stood up, and banged his fist really hard on the table. He said, "You think I don't love my family? It's people losing out here." He was so loud you could hear him all the way down the hall. He said, "You have no idea. You have no idea what it's like to be me."
Mm.
I sat my ass down. Like it startled me so much that my eyes immediately started stinging with tears. He was like, "If I miss work tomorrow, I could lose my job. I have a good job. My job has benefits. And let me tell you something. If you are a person with a felony charge, it's really hard to get a good job with benefits. But guess what? I have one. Oh, and you know what else? I got to meet my parole officer tomorrow. And yeah, y'all say y'all gonna write a note. But let me tell you what's gonna happen if I miss my parole officer meeting. I can tell you right now, I'm gonna get a warrant. And guess what's gonna happen if I get picked up because I missed my PO and I got a warrant? I'm gonna go to jail. And guess what's gonna happen if I go to jail? I'm gonna be there 40 days. You know why? Because can't nobody bail me out. Because we don't have money to do that. So if you asking me why I need to get up out of here, it's because I love my family. I love my family more than I love myself. Now I need you to get the fuck out my way so I can get to my family so I don't lose my job and get my lights turned off so I can't take care of them. You have no idea. My face was like 150 degrees. And he was so loud that you could just hear it all down the hall. And I
Mhm.
was the only one in the room with him. And if you are waiting for me to tell you about how it became tender and then we connected and I said I understood, no, that did not happen. He was muttering, talking about, I don't love my family. You got me, man. You crazy. I don't love my family. Man, everything I do is for my family. You don't like, man. And I have no idea what kind of felony charge he caught.
Mhm.
I have no idea. Something tells me from his age, something tells me it was something that probably did not warrant the amount of time that he has spent locked up. I do know for sure that he was locked up for about 17 years. I do know that. So if he was 48 8 years ago and he had been locked up for 17 years, that times out just about to the war on drugs.
Mhm.
And he probably had something very minor happen and probably got sent away, 3 strikes. And I don't know. I mean, I'm piecing all of this together, but I learned a very mighty lesson then. I learned a lesson that just because I have racial concordance with you and just because I have cultural concordance with you does not mean I have socioeconomic concordance with you.
Mm.
And that day, I got put in my place. I was so wrong to assume that this man did not want to be in the hospital just because he just didn't feel like being there.
Mhm.
That was the furthest thing from his mind. And since then, I always pay attention in my histories now. I ask people about if they have anything in their history where they need to like go to work or a parole officer or anything like that. I ask that up front. I'm stunned at how many of my patients are on parole.
Mm.
So many. I mean, we could have a whole conversation about the parole system and what it does to our patients and how many people get locked up. But that patient taught me that day that when I hear somebody say they've been in jail 40 days, it is almost always that something minor happened. They got locked up and couldn't afford bail. That just happened to me last week. Somebody was in jail 40 days, couldn't get none of their medication, and came in with an exacerbation of a chronic problem. Yeah, so I was very much put in my place. He left. And back then, that was back before I understood that there's nothing good about making people sign AMA forms.
Yeah.
So I don't do that anymore. I don't ask people to sign those forms. But back then, to add insult to injury, he had to have the humiliating experience of signing a piece of paper that, for the most part, says, "Hey, you making this stupid decision. You need to sign your life away for it."
Mhm.
Not even thinking about like what it could all mean. So
Yeah. Wow. man, we make so many assumptions, paths and lived experiences. We have no idea. Even when there are like important identities that we can share with our patients. I remember as a resident in clinic having a patient, an elderly Black woman whose kids finally made her come in after she had not been going to the doctor for like decades. And she had raging diabetes, hypertension. In my mind, I was like, well, it's your lucky day. Like, I'm going to assuage all of, your concerns because I'm Black, you're Black, you probably just haven't had a Black doctor before. And, I learned quickly that, it's not just about those identities. Like, this woman had an entire lived experience that doubled my age. And, it wasn't a given that she was going to be on board.
Yep. The other thing I learned too was that I had I kind of came in there like with a script or like a bag of tricks that I was going to try, you
Mhm.
know?
A framework.
Yeah, you know what I mean? I didn't meet him as a human. And, here I am, the person that's always telling people when they call a patient difficult, it's because blah, 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 and that's bias and, all this stuff I would be telling people. I still made him a monolith. I came up with this idea of like, okay, this is gonna work, this is gonna work. Instead of saying, I never once asked him, why do you why you need to go?
Mm,
What's so urgent? What's going on? What's
yeah.
going on, friend? And since then, like if I had come in the room and saw him in that flannel shirt and said, "Hey, brother, I'm told you need to leave. What's going on?" He would have told me. He would have said, I got to go to work. And I probably would have said something back. And if he had told me what he said, because he's right, he had a really great job. And if you got a felony conviction on your record and you've been disenfranchised, he told me he can't even vote. He said, I can't even vote.
Hmm.
You think I'm about to stand here and let y'all mess up my good job? You crazy. And I'm like, how many people have to make decisions like that
Mm,
every single day
yep.
and have the added humiliation of somebody who looks like them wagging their finger in front of them, telling them, that they're doing the wrong thing. I should have rolled a red car. I should have called him an Uber to go where he needed to go.
Yeah.
I'm serious. It's like,
Yeah. It's hard. But, who but you would take that lesson and then apply it further down the line and also be able to share stories like this that advocate for how we need to restructure our thinking around, people who leave against medical advice, quote unquote. It sounds like you've changed how you take your history and incorporate that up front with it, which I think is awesome. And then when you do have patients who want to leave, like, so you don't bring the form anymore, like, what's your
no, I don't. I don't. So I will say that there was a really good article in the Journal of Hospital Medicine in the Things We Do for No Reason section. I love those pieces, by the way. Shout out to Journal of Hospital Medicine. But it was about AMA, asking people to leave against medical advice. The long game is I want to still have a therapeutic alliance with you. I also want you to have trust in the healthcare system. Where I work, a lot of the people that are asking to leave against medical advice are resource poor. They usually come from historically excluded groups, and sometimes there's a lot of things going on at the same time. But I usually try to co-create some kind of plan. Once I learned that there's no real legal protection for you with that little piece of paper, I realized I'm actually better off creating some type of plan with good anticipatory guidance. I often will give people medications to go
Mhm.
with. I'm not going to be like, nah, nah, boo boo, I'm not giving you any prescriptions,
Yeah.
that's what you get. Like, no, if you're trying to leave the hospital and I want you to stay, I do say I really want you to stay. And now I ask people why they need to go. And sometimes asking people where they need to go, I can come up with something to help them.
Mhm.
It could be really simple. It could be like my granddaughter is at home with my daughter and she don't have no Pampers. I could be like, oh, I'd rather you stay here than Pampers, than leave here for Pampers. Guess what? I will get on Instacart and send some Pampers over there. Like I'm not suggesting y'all do that with your own resources, but you know what? Look, I work in a in Grady Hospital. I mean, I
Mhm.
do a lot of stuff. So,
Mhm.
I mean, I don't know. Sometimes you can find resources. Our social workers oftentimes too will.
Yes, exactly. Like there are creative ways of doing things, but
Yes, yes. Ashley's going, you're going to end up editing that out. You're like, you're telling
oh,
people
no,
to.
I'm gonna keep
But
it.
no, but like, yes, there are often things that we can do. But the problem is that a lot of times we don't know what your needs are.
Mhm.
And if you've been struggling your whole life, and you don't have, all you know is struggling,
Mhm.
you know, you got to
Yeah.
just get up out of there.
We have plenty of examples at our hospital, the general, of people, folks who are marginally housed and have like pets that they need to,
Yes. Yes.
and
It's like simple
yeah.
stuff. It's like, oh, that's what you need. Oh, you need somebody to check your mail. Oh,
Mhm.
you need this. I don't know. But just that whole like thing that you think you're going to come in there like on some auntie stuff, telling somebody that they need to do better.
Mhm.
Um, that's not cool. And have you ever heard anybody say F.A.F.O?
F.A.F.O.
F around and find out.
Oh yeah, okay. Yes, yes.
So that was a F.A.F.O moment, me and that man. I got in his face and I started trying to suggest that that man was choosing himself over his family. And he was like, you about to F.A.F.O.
I'm just trying to picture what happened after he got done telling you, like dressing you all the way down. Were you just like, okay, well, I'll see.
I looked exactly like I look now, which is like my mouth was hinged open. My face was so hot though. It was so, I still remember how hot my face was because that doesn't really happen to me that much. I was really like really horrified. And to be clear, I never once thought that he was going to harm me or
Mhm.
anything because some of the nursing staff thought that he was like going to be violent toward me. I was like, he was not. He was just passionately letting
Mhm.
me know that I insulted him.
Mm,
And he had every right.
mm, mm,
He had
mm.
every right. And he walked right on out of there with his little flannel shirt on and his little jeans that he zipped up and his Chuck Taylors. And he didn't even say bye. He was just like,
Yeah.
lady.
Whew.
Some days I'd be like, can you just get readmitted so I can have a do-over, please?
Yeah, I would like to try this
I'm
one.
so much better now, sir.
I have a couple patients I would like to have on recall to try again.
Oh, man, I was like, I got cussed out, and then he just left. I was like,
Man.
and of course,
Well,
the staff was all, Dr. Manning, you're my favorite doctor, You feel better. You're my favorite ever since you first got here. I'm like, thanks.
oh man.
Oh,
Well,
Lordy Lord.
thank you for, I mean, not only for your exceptional storytelling skills, but your humility. Like, those aren't, we can laugh about it now, but I know that feeling when you just got dressed all the way down and like for good reason, like that hurts.
For good reason. And with a whole bunch of people who heard it. Because he was like not in a like, I was like, why we couldn't put him down at the room at the end of the hall? Why he got to be in the front room by the nursing station, cussing me out like this. I was
Man,
impressed that he figured out how to get the telemetry box off so smoothly.
great. That man was on a mission.
Oh Lord, that brother was not trying to stay at Grady Hospital.
Mm.
Well, friend, I always love telling you a story. And I will say I did track him in the electronic medical record and he followed up.
Oh, wow.
Yep.
Wow.
So, another thing that somebody probably didn't see coming.
Yeah,
He loved his family and he loved himself.
absolutely. Well, I love you, sis. I thank you for these lessons, these pearls of wisdom. I hope the rest of your evening is very chill with nobody screaming or cussing you out, and that your heart just continues to be filled with all the joy that you put forth in the world.
I sure appreciate it. I received that, sis. I love you.
All right. Have a good one.
You too.
That wraps up this week's episode of the Human Doctor Podcast.
Special thanks to our favorite brother gastroenterologist, Dr. Chuma Obiname for the beats. Shout out to the Dr. Ashley McMullen for editing and production.
Mad love to our podcast family at The Nocturnist and the Clinical Problem Solvers, our Med Twitter fam.
And especially shout out to all of you, our listeners.
Until next week, remember,
we see you and you are enough. Holla!